Hello, everybody, and welcome to the PharmAssist virtual learning experience tonight. We appreciate your patience as we are getting things started. The internet is a fickle friend sometimes, so we were able to get things ready to go. We appreciate your time. And real quick, before we get started, as always, I would like to read our little disclaimer here, and that is the PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And since we have that out of the way, I wanted to thank you once again for joining us for the PharmAssist Virtual Learning Experience, which is an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding health professionals right from the comfort of your very own home. PharmAssist takes place every Monday night at 7 p.m. Eastern Standard Time, and tonight we will be providing a live medication instructional program on 3 fertility products, including interactive Q&A throughout the program. As always, we are joined by various amazing HCPs each week from across the nation to provide you with a real-world experience, just as if you were sitting across the table from them in their clinic. And today, we are joined by Karen Hammond. So thank you for joining us on Zoom or Facebook Live. We invite you to be a part of the discussion by sharing your questions with Karen in either format. So again, thanks for your time and interest. I want to thank you, Karen. I want to turn it over to you now. Take it away, Karen.
Thank you so much, Craig, and good evening, everyone. Happy Monday. You've made it through the first day of the week. At this point, I just want to introduce myself. I'm Karen Hammond. I'm a women's healthcare nurse practitioner, as well as the IVF program director at American Institute for Reproductive Medicine around here in Birmingham, Alabama. I've been doing this for a long time. I am approaching 4 decades, hard to believe, in this field. And I tell you, when I first start to talk to patients and they know that the information about medications and injection is coming, it's very intimidating. But I'm here tonight to tell y'all that it is really easy. The medications are quite streamlined now. We can show you just in a few little videos how to do 3 of the medications that I most commonly prescribe. And they are the Gonal-F Red Eject Pen, HCG, and progesterone and oil. Of course, your healthcare provider will tell you exactly what medications you need to take and will prescribe everything just like you need. But I want to go over with you and just tell you a little bit about each of these injections that we will show you on the video. So sit back and relax. I'm just going to show you the quick and easy way. And we're going to start out with talking about Gonal-F Red Eject Pen. So Craig, if you'll go ahead and cue up the video, and then on the other side, we will take any questions that you have just to make sure you're totally comfortable with taking this medication. I'd like to talk with you about how to administer Gonal-F using the Red Eject Pen. If your prescriber has prescribed the Red Eject Pen for you, it's very simple to give yourself the injection. When you take the pen out of the packaging, you simply remove the cap, and you'll see a dosing window on the side that tells you exactly how much medication is actually in the pen. Next step in preparation is to take one of the needles, and it comes in a little package where you just pull off a tab, and then the needle will screw directly on to the tip of the pen device. Next, you'll dial your dosage, and for today's purposes, we'll say the dose is 150 units, and you just dial that. You see it in the window. No worries if you go beyond it. You can just dial the pen back the other direction, then take the top off of the needle. There's a big cap first. And then secondly, there's a tiny cap to cover just that tiny little needle. And to administer this, you give it subcutaneously. That means in the fat, generally in the abdomen or the outer part of the thigh. To do this, just choose your site first. If you want to give it in your abdomen, you should go someplace around your belly button, like where these little blue areas are. or either in the outer part of the thigh, anywhere really that you can pinch an inch. Then you pinch up the area because you want to make sure it's going into fat. You bunch it up a little bit, put the needle straight in all the way, and then depress the plunger. You'll feel it vibrate just a little bit as the medicine goes in. Then release the plunger, wait a couple seconds, and pull the needle straight out. And just like that, you've given the injection. After you've administered it, you want to carefully remove the cap remove the needle by putting the outer cap back on and untwisting it. Then you can dispose of it into a sharps container or protected device. Just drop it in there. If you look in the window after you're done, it'll tell how much medication you have left. And these pens are somewhat overfilled. So just because you've used what you think the total dosage is, take a look in that dosage window because you may have some extra that you can use. Then recap it and you can place it back on the counter until you're ready for your next injection. Perfect, Craig. Thank you. So just like that, it's easy as pie to give this injection. It's nice that they come, that the gonadotropins, a couple of them come in little pen devices, so you don't have to worry about mixing and reconstituting and to prepare it to do the injections. If you've been prescribed Gonal-F, this is the easy way to do the injection. The Gonal-F is follicle stimulating hormone, and it's, excuse me, one of the few hormones in our body that does exactly what it says it will do, and it stimulates follicles to grow in women. So you'll take whatever dose of this medication is prescribed for you. Again, your provider will tell you what dose is right for you, and you just click in the dosage window, dial it up just to the right amount just for you. There are multiple doses in the pen for most people, and just take a look in that dosage window. You can see when the cap is off. Just take a look right there and it'll tell you exactly what you have left. I will tell you that that these pens are overfilled. So there's a little bit more in there than what you're going to use, and take that as an extra added bonus. So don't waste that medicine. Don't just throw it away when you've taken what you think is all of it, or don't worry that you haven't taken quite enough, because you, I'm sure, have taken the right amount. As soon as you push it down, the dosage window goes back down to 0, and you can take a look and see how much medicine you have left in there and when it'll be time to start a new pen device for your next dosages. Now, if your dosage, for example, is 225 units a day, and you look in your pen and you've only got 200 left, you can still do it. It'll just be taken in 2 different injections. So go ahead and dial it to inject 200, then start a new pen device and inject 225. So just do the simple math to figure out exactly what you need, what's left over. If you can't really tell exactly how much is left, go ahead and dial it to 225, inject the medicine, and it'll say in the window when you first dial it up, it'll say in there, after you push the plunger all the way down and take the needle out, it'll tell you exactly how much you need to dial for in the next dosage. So Craig, I'm going to turn it back to you to answer any questions that the folks may have.
Perfect. Thank you so much, Karen. I appreciate it. Just a couple of quick things for everybody. If you are joining us in Zoom, feel free to ask any questions in the either in the Q&A section or just in the general chat. And then obviously, if you're on Facebook, you just join right in the chat. You can ask any questions and we will get to them. And we will definitely continue to answer questions throughout the course of the program, so that don't feel like if you don't get it in right now or you think of something later, we will have a chance at the end to ask questions about all of the 3 products that we talk about today. And so speaking of, we have a question that just came in right here from Tiffany on Zoom that says, is this medication painful?
Great question. And people always, I guess we just revert back to our childhood when we think about taking these medications or taking any type of injection. This medicine, I promise, I've taken it myself. You can't feel it at all. The needle is very tiny. It's smaller even than a needle that's used for diabetics to take insulin. So it's teeny tiny. You'll hardly feel it go in, and the medicine doesn't sting or burn at all. Now, in the video, I didn't show wiping the area with alcohol first. Some people feel that that's important to do. I don't think it matters much at all. If you've got some germs there, it's probably just going to move them around instead of take them away. So don't get overly obsessed about scrubbing with alcohol. But if you do decide to wipe just one time with the alcohol, then I'd recommend that you let that dry before you inject it, because wet alcohol, when you put the needle in, may cause it to sting just a little bit. So just let the alcohol dry. Otherwise, it's going to be a pretty painless injection.
Great. I'm sure everyone is very excited to hear that. That's a question we get for just about every single medication product that we talk about. So yeah, you will probably hear some of those questions come up again, Karen, about our other products as we move forward. So here's a question that came in on Zoom as well from Jesse. Does the pen have to be refrigerated between uses if it's used multiple times?
That's a great question. And that's very common concern that people have, because when you get it in your package from Mandel's, you'll see that it says keep refrigerated. Well, the short answer is no, it does not have to stay refrigerated. Once you get the medication, as long as it's used within 30 days, it does not have to stay refrigerated. So what I recommend when patients take injection, the Gonalef RediJect pen, is just take it out of the refrigerator half an hour or so before your injection, just to let it come up to room temperature, give the injection, and then just recap it and put it on the counter until you're ready for your next injection. So as long as it's used within 30 days, it does not have to be refrigerated. Then again, if you're like me and a consummate planner and you want to make sure that you've got all of your medication well in advance of your treatment cycle, you may have it more than 30 days. You may have had it sent to you really early. In that case, again, just keep it in the fridge until about half an hour before your first injection. Then you can take it out and it's ready to go, and you don't have to refrigerate it.
Great. Thank you so much for answering. And that's a great answer. And I think a lot of these things, people get a little bit nervous about not just the shots themselves, but the process around them. And that's one of the things we're here to do, is to make you feel like a pro and to really put you at ease so that you feel comfortable with everything from the beginning to the end of this process. And instead of focusing on, the injections, the medication, we're focusing on the journey and the path of what we're trying to get to here at the end. Right. So thank you so much, Karen. And one of the things I love about this program is the interactive nature. So really quickly, I just wanted to throw in there, and I apologize if I mess up your name at all. I'm just trying to catch up. But there is a message that came in on Facebook at somebody, Sampathy, I believe it was, said that I have been using the product for about a week now, and I don't feel any pain. So
great.
Just going in from the original question about that Tiffany had. So we're able to work together here and hear from one another and really kind of help each other through it. So thank you so much for that. I really do appreciate that. Okay, so we'll move on to the next question. So you had mentioned something about the overfill that in the pen, Karen. And so this question came in and it says, so how does the overfill factor actually benefit me? Is it difficult to know when the pen is really done versus the labeled amount?
Great question. And definitely the overfill benefits you. If you think about the cost of the medication, if you try to do the math and you think about the cost per unit of the medication, and you're getting 50 or 75 or 100 bonus units, that's definitely benefiting you. It's like getting bonus medication. So you want to make sure that you use, as long as it's prescribed, continue to use all of it so you can take advantage of that overfill. You can tell when you're getting close to the end or at the end when you have the cap off of the RediJect pen. When you look at the window, it will tell you exactly how much is left. So you can take a look at that. And also, as I said earlier, just dial your usual dose, inject it, and it'll say in the little tiny window to tell exactly what your dose is. It'll tell how much you need to give with the next pen. So don't waste it at all. I'm always up for a good deal, and that seems like a bargain when you're getting extra medication.
Awesome. Bonus medication is great. I think that's something that everyone wants to know about. So that's great to know. And thanks for walking us through that. One quick thing. I feel like now as the messenger, I might as well pass this on, Karen, but I assume that they wanted me to say this because it's right here on Facebook, but Celeste Chandler says, Zach says, hey, Karen. So
Oh,
you
hey
know,
y'all.
people are in here to support as well. They're not just here to listen to the conversations, but also to support you, Karen. So thanks for doing this. We absolutely appreciate your time and expertise every single time you get on here with us. So thanks
It's
again.
my pleasure. Thank you.
Thank you. Now, here's a question that came in on Facebook that you've answered this question many times on these programs before. I think just as much as like how to utilize the medication. The number one question that we always get is how do these actual things work? And this question, somebody just came in on Facebook that says, what is the actual point of Gonal-f anyway? How does it work?
Well, like I said a little bit earlier, Gonal-f is FSH, and it's one of the few hormones in the body that does exactly what it's supposed to do. It stimulates follicle growth. So follicle stimulating hormone stimulates follicles to grow, and follicles are the egg sacs. If you want to think a little bit about reproductive physiology, our bodies respond to low levels of estrogen in a natural cycle, usually by making follicle stimulating hormone. The low estrogen signals your brain to make gonadotropin releasing hormone that tells your another part of your brain to release the gonadotropins FSH and to a lesser extent LH. And those two hormones work directly on the ovary to develop and grow the follicles. And inside each follicle is an egg. As the FSH pumps more and more, the follicle gets more and more mature. Now, the reason we prescribe these medications to our patients trying to conceive is perhaps you don't ovulate regularly or normally, or maybe we just want to stimulate your ovaries to work a little bit harder. Would do that in cases of superovulation for an insemination to give you kind of more than a single chance in one cycle. Or if we're doing in vitro fertilization, we benefit by getting more than a single egg. So hopefully we can get several eggs and have embryos to choose from when it comes time for the embryo transfer. The other hormone other than FSH is LH, and there is a medication that we sometimes prescribe that we'll cover in another video that is called Menopur, that has a combination of both FSH and LH. We might want to use the Menopur, for example, in a patient who is particularly thin, who doesn't make enough LH on her own. Women that don't have periods at all may benefit from a combination of FSH and LH. And women that are getting their ovaries suppressed a little bit on their own with something like a GnRH agonist or antagonist, such as Lupron, Cetrotide, or Ganirelix. And all of these medicines we'll talk about in subsequent videos as well. So go by what your physician or your provider tells you, which medication is right for you. They've thought about it, they're experienced, and they want you to have a baby just about as much as you do.
That's good. Thank you so much. And it really is a partnership here with everybody, not just with your physicians and your nurses, HCPs across the board and patients, but obviously also with the pharmacy. And that's what we're here for, is to try to be the bridge and really be the trinity that helps get you to the goal that you want, which is to have that baby. So great to hear. Actually, a question that came in from Sampathy as well, just related to that, what you were just talking about with the follicles. And I know we've said a few times that this is, we're trying to talk a little bit more general, and when you have specific medical questions or things like that, to bring them to your HCP. But just as a general idea, Sampathy was wondering, how many follicles would you say is good for an IVF cycle with the FSH trying to get you those follicles?
Gosh, that is a great question. It's going to be individualized based on what your particular diagnosis and your particular goals are for your treatment cycle. There are some cycles that we do a minimal stimulation because maybe you don't want to have a whole lot of eggs. Maybe you're at risk for your ovaries getting too big and having ovarian hyperstimulation syndrome. Or maybe you're concerned about having embryos in excess of what you're comfortable transferring. Maybe you don't feel comfortable with freezing. On the other hand, maybe you want to just be one and done and have as many embryos to freeze as you can. those are goals that you're going to need to work through with your healthcare provider to come up with what is absolutely best for you. It only takes one to make a baby. I have lots of patients who do minimal stimulation where they don't take very high doses of this medicine and don't take it for very long. In those cases, our goal is to have one, and we get just as many babies from having one as we do from having 17. But what you might have to freeze later on can vary. So this is something you should certainly talk with your provider about to see what your mutual goals are.
Great. Thank you very much. Karen, so here's an interesting question that Sampati just followed up with as well, and was wondering, just in general, when it comes to Gonal-F, is there a risk or anything or any information out there that you are aware of that shows that this medication could potentially be cancerous or have any deleterious effects down the line for a patient, taking it in the short term?
Great question there too. We always wonder about the safety of medications that we take, not just in the short term, but what might they do to us in the long term. A number of years ago, gosh, it's probably been 15 or 20 years ago, there was a long paper that was published that, and medical literature, that kind of linked fertility to an increased risk for ovarian, endometrial, and breast cancers. But it was just a very small part of the paper, but it got a huge amount of press. Well, upon looking at that more carefully in our field, we found that it was only if you took a medication called clomiphene citrate for more than 12 cycles was there any kind of risk. So the short answer again is there is not an increased risk for that, for reproductive cancers when you take FSH. This medication is something that your body normally makes, and it's not going to put you at any undue risk. However, there's a little bit of a but coming. Women that don't have regular periods are at a little bit of increased risk for having endometrial cancer, and women that don't ovulate also are less likely to have become pregnant on their own. And women who have never been pregnant are at a little bit increased risk for ovarian cancer. And it's just something to keep in mind that those are confounders. So as women, we need to be good consumers of our health care. We need to have the appropriate screening for breast, ovarian, and endometrial cancer. And just like all women that have problems with their fertility need to be especially screened because they may be at an increased risk just from having the diagnosis of infertility, not necessarily because of the medications.
Yeah, it's really good to mention that. Obviously, if you do have any of these questions or concerns or anything, this is a perfect situation to bring up with your HCP, with your nurse, with your physician, just to make sure that you feel comfortable. Because the number one thing is to understand the process and to know what you're going through and what your body's going to be going through to make sure that you can focus on that end goal. So thanks again, Karen, for a great answer to a potentially interesting question that we had there, Sampati. We appreciate it. And any of these types of questions, this is a great opportunity to have those answered. So another question that just came in on Zoom, talking about can these medications impact your regular cycle or cause any other issues in women over 40?
What was the last part of the question?
So can these medications impact your regular cycle or cause any other issues in women over the age of 40?
Great question. These medications sometimes will almost take over your cycle. So when we give higher dosages of this medication, it can make your cycle, it can make up the duration of the first half of your cycle, the time that your follicles take to grow. It can make them shorter or longer. With respect to the age, doesn't really matter at all. As we get older, our ovaries make less and less estrogen, so our brains pump out more and more FSH. It's the same thing that's happening. If you're older, you may be prescribed a higher dosage of FSH. Age is not a particularly concerning factor.
Perfect. Thank you so much. And I just want to throw out there to everybody, anyone who is also feeling this, that the concept of 40 being a breakdown between younger patients and older patients, don't worry, we feel your pain because that is not considered old. You're fine. Don't worry about it. That is it's a perfect. You're super young still, so you got this. With that being said, I did have a question that this is a first, I think, for the program across the board. But this question came in on a Zoom that says, I've heard of a Facebook for injections called priming a pen. What does that do? And is it necessary when it comes to Gonalef?
I don't think it's really necessary for any of the pens personally. The Follistim pen, the instructions say to prime it. And what that means is just once you get the needle on the pen, just move the dosage plunger just a little bit, and a little bit will squirt out the end. I don't think that's particularly important because this pen already comes assembled. It's ready to go. And you can tell if you didn't get the medicine because the plunger wouldn't depress. And when you look in that window after you give the injection, it would say the exact same thing. Priming is something that we talked about a lot when these pens first started to be developed, but I really don't think it's so important, especially with the Gonalef ReadyJect pen. Great question.
Perfect. Thank you so much. And so Sampathi, who is also essentially now a co-host on this program, because a lot of great questions coming in. And another one here that says, does this medication or does Gonalef have any side effect regarding weight gain in the future or, while you're currently on it?
Just about any medication you think of, you think maybe that's going to cause weight gain. With this medicine, the medicine itself is not going to cause you to gain weight. However, there's another but here. After you ovulate, if you have a big response to the medication, if you have several follicles that get to be mature, your ovaries get bigger, and there can be a shift from fluid inside the cells to outside the cells. And that's one of the hallmarks of ovarian hyperstimulation. If that happens, you can expect a few pound weight gain. And sometimes the weight gain can be fairly excessive. This is transient. Your provider will work with you to make that fluid shift go back in the right direction and make that correctable. Commonly, when we see patients that have hyperstimulation like that, where they do have some excessive weight gain, they're commonly pregnant. So I generally tell patients that by the time their weight gain has dropped back to where it should be and their belly is not swollen anymore, that will be swollen from pregnancy. So it doesn't cause weight gain that's permanent fat that's going to stay around for a while, but it can cause weight gain that's just accumulation of fluid. If that happens, that's definitely something you should notify your healthcare provider about, because we'll want to monitor you and correct that as early as possible. Great question.
Perfect. So as of right now, we are caught up with all the questions. And so I just one more time want to remind everyone that do not worry. We're not cutting you off when we move to the next product. You can always come back to any question or any product at any point in time. But at this point in time, Karen, if it's okay with you, just give another 30 seconds in case people are trying to get something in. They're trying to type something up. And so I'll throw it back to you. If there's anything else you wanted to say before we prepare to move on, I'll keep an eye on the questions coming in.
Sounds great. So I'll tell you a funny little side story. When I first started in this field, there was one medication that's no longer commercially available that we had patients take for fertility injections. It was called Pergonal. And this medication came in 2 little glass ampules, and it came with a little saw or a little file, and you'd have to file off the top of the glass ampule that had the powder in it. And then you could snap off the top of the glass ampule that had the liquid. And it was such a science project to try to get into it and then to mix it up. Then all of these injections were given in the muscle of the hip. So we've come a long way from the little science project getting into the ampules and mixing it to having it in a pen that you just can give essentially anywhere in subcutaneous tissue and fatty tissue, any place, like I said in the video, that you can pinch an itch. So it's a great time to uh, to be of reproductive age now, so that we have many options for you and we can tailor the treatment just for you. So any other questions, Craig?
Well, one thing I just want to say, thanks for putting it all in perspective. And I think that's something that everyone's looking for here, is to really understand, what you're about to go through, and understand how easy all of this really is. And that's what we're trying to do, is make you feel comfortable. With that being said, we are all out of questions right now. So again,
Okay.
if you have any, as we move on, we are getting ready to move on to the next product. But if you think of a question for Gonalef, you can always ask at any point in time. But we can move on after this.
Okay, perfect. So the next medicine I want to talk to you about preparing and administering is HCG. Sometimes people call this a trigger shot. This is really important if you are taking medicines that stimulate your ovaries, especially the injections. In a spontaneous cycle, if you ovulate normally, the FSH is going to be produced by your brain. You're going to grow the eggs, and then that will signal at when your follicle is big enough, it'll signal through a pathway through your brain again to make a huge release of LH. You may have heard this called an LH surge if you've just taken some of the oral products like clomiphene or letrozole. However, when we give these medicines that stimulate your ovaries more aggressively, then the higher levels of estrogen can actually block the LH surge from happening on its own. So for those reasons, we recommend that you take a medication that mimics the LH surge. The closest thing we have to that, the best thing that we have for that is the HCG. It acts just like LH, but with a little bit longer half-life. So your provider will tell you exactly what date, and oftentimes even exactly what time to take it. So it can be timed perfectly with a procedure like an insemination or an oocyte retrieval. So Craig, if you'll go ahead and cue up the HCG video, we'll go through that, and then we'll answer questions about it. You have been prescribed to take HCG by your healthcare provider. You should have been told a specific time to take this medicine, because this does the final maturation of your eggs to prepare them for either ovulation or egg retrieval. It's actually quite simple to do this. There are a couple of routes of administration you can do this. Your healthcare provider will tell you whether or not to take this injection directly in the muscle or just into subcutaneous fat. So we'll go through both those ways. If you've been prescribed to take this medicine just subcutaneously, then that should be given in the area beneath your belly button and out to the side, or in your outer thigh. To do that, you just bunch up a little bit of tissue and put the needle straight in. If you've been prescribed to take this medication intramuscularly, it should go in the muscle of your hip. To do this, just put your hand on your hip bone, and way up in the upper outer quadrant is where you'll give this injection. And you can see in this picture, it's the upper outer quadrant. Your nurse or healthcare provider will be happy to point out exactly where you should give this medication and whether you should take it intramuscularly or subcutaneously. To mix the medication, it's actually quite simple. You'll need the contents of the box of the HCG, which will have a vial that has liquid and a vial that has a little bit of powder in there. It may actually look like a little cake. Next, you'll need a syringe to mix the medication and to draw it up for injection. Start by removing the cap from each bottle, just by lifting it up. The powder and the liquid, just lifting it up to remove it. Next, open this package that has the syringe and the attached needle, and then remove the top from the needle, just by pulling it straight off. Next, take the tip of the needle and insert it into the middle of the rubber part of the vial. You'll want to be able to see the needle in the liquid. Although there are 10 cc's of liquid in the bottle, you're really only going to need about 1 cc. The exact amount of liquid doesn't really matter. The liquid is simply to dissolve the powder. I generally tell patients to withdraw 1 cc. And you do that by just gently pulling back, making sure that the needle can be seen in the liquid. If you have a little air in there, that's okay. Then take it out. Just push straight up to make any air bubbles come out. And then take the bottle of powder and insert the needle into the same place at the top of the vial. Push in all of the liquid, and the powder should dissolve pretty instantly. If necessary, you can just swirl it around a little bit and it dissolves very quickly. Then turn the vial upside down, again making sure you can see the tip of the needle in the fluid, and withdraw all of that mixture. And remove the needle from the vial. If you've been told to take this medication intramuscularly, it's ready to give. The needle's already on. You just simply need to choose your injection site. If it's going to go in the muscle, it'll be this needle. You separate the tissue so that it'll go deep into the muscle. One wipe with alcohol, and then put the needle straight in all the way. Pull back on the plunger just a little bit. You're probably going to get a little bit of air back. That's completely normal. If you get blood, just pull back just a tiny bit on the needle and go ahead and push the medication in. And then pull the needle out straight, all the way out. If you have a little drop of fluid or a little drop of blood, that's completely normal. Just wipe it with an alcohol pad, and you can apply a bandage if necessary. Then you can carefully recap the needle, remove it, and place it into a sharps container just to avoid any injury later on. If the medication has been prescribed for you to take subcutaneously, choose the injection site and change and put on one of the smaller needles that will be prescribed that will be sent to you with your medications. The needle will just similarly screw right on the tip of the syringe. Choose your injection site, wipe it just once with a little bit of alcohol, bunch up the tissue, and take the needle, put it straight in all the way, inject the medicine, release the plunger, pull it straight back all the way. Recap the needle and place the needle and syringe directly into your sharps container. Congratulations, you've now reconstituted and administered your HCG injection. How easy was that? I'm sure that people are going to have questions about this. It is a little mini science project to mix up this medicine. If you've done it once, you can do it 1,000 times and it'll be so easy. In fact, I'll have people in my waiting room saying, oh yeah, it's easy. You know, you just do this and this. And it's actually a very simple medicine to give. A question that I commonly get is, can patients bring the medicine in? Let us go ahead and mix it so that all they have to do is inject it. I tell people that I really prefer that they mix it within half an hour of administering it. So it's not that I don't want to mix it and help you out with it, but I think it's best and more stable if you mix it up shortly before you give it. And Craig, I'll bet there are some other questions as well. Tell me what you got.
Perfect. So now, because we are very adept at thinking on our feet and dancing with the questions that come in, I do have one for you, Karen, that came back on Gonalef, and I just want to make sure that we do not overlook Sampathi's last question that came in, and that one is, this says, do I need to take any special care of myself while on this medication? I mean, with respect to food, exercise, etc., anything like that?
Great question. You know, anytime you're undergoing fertility treatment that involves stimulating your ovaries, you should really try to take care of your pelvis. Your ovaries get bigger when they're stimulated. The follicles are actually kind of like a blister on your ovary. So a little bit goes on the inside, a little bit on the outside. And if you have lots of follicles that are growing, it can be a little bit uncomfortable. And when your ovaries are stimulated, they're a little bit more likely to twist a little bit and cause a lot of pain. So I recommend to my patients that they shouldn't do anything that's too strenuous, especially with their abdomen. you should talk with your own healthcare provider to find out what's recommended for them. I found in my experience that different healthcare providers recommend different things. For example, I tell patients that they probably shouldn't run more than 5 miles a week. And once they start the stimulants, they should decrease that down to a walk after dinner, while other providers are completely comfortable with keeping up running. Similarly, I recommend in general that patients shouldn't go to the gym and do their Pilates and work out their abs while they're doing this. The best thing you can do is talk with your healthcare provider and listen to your body. Listen to the cues that you get. If you do something that's uncomfortable, that's a message to stop doing it. Thanks for bringing that question up, Craig. Thank you.
Perfect. Thank you so much. And again, remember, any specific questions you may have like that, we're always here to answer a little bit more generally and to really give you a comfort level with the overall utilization of these medications and how to treat yourself throughout it. But any specific questions, do not hesitate to bring those back to your HCPs and make sure you get their specific ideas on how they would like you to handle that. But I think that was a great question. Thank you, Sampati. We appreciate it. Now moving back onto the HCG, there is a question. I know you talked a little bit about the mixing of the powder and the vial, and this question came in, and I know we've talked about this a lot on the program before. The amount of powder looks different from vial to vial. Does that mean that I might have too much or not enough? Is it something I should be worried about? Could it be dangerous?
Great question. HCG is a generic name. It's human chorionic gonadotropin. And different brands have different amounts of powder in there. However, it's still going to be 10,000 units or 5,000 units that's in the vial. HCG comes with both those dosages, either 5,000 units or 10,000 units. Your provider will tell you which one to take. If you've been told to take 10,000 units and this is your second cycle to do it, and one cycle it looked like there was more powder than the other, no cause for alarm at all. It's probably just a different brand. But I would feel very comfortable that the right amount is in there and just mix it with the amount of liquid you've been instructed to use. I'll also tell you that there is another formulation of HCG that is recombinant or made in the lab, where this is made from human-derived products, the HCG is. Ovidrel is manufactured in the lab, not using human products. For that, it's 250 micrograms that are in the dosage. And sometimes people will say take either 1 or 2 of injections of that. We'll cover the Ovidrel in a different video. So I'll be happy to take any other questions on the HCG.
Great. Thank you so much. And this question came in, and I know you talked a little bit about the concept of why the trigger shot, what it's supposed to do, and why your body needs it. And this question just came in and says, is the trigger shot absolutely necessary, or is it possible that my body could handle it on its own?
You know, it is possible you could ovulate on your own if you don't take the HCG, but it's pretty important, especially if your ovaries are stimulated with injections. It's important that you take it because your body can be blocked from ovulating on your own with higher levels of estrogen. It's also really important to take that medicine right when your follicles are at the point of maturity that pregnancy is going to be maximized. If you take that medicine right when your follicles are mature and a specific period of time before your procedure, we know that your eggs are either going to be ovulated or perfectly mature and ready for your egg retrieval. So if you take injectables, you really need to take the HCG. Great question.
Thank you very much, Karen. And so this question, I know you mentioned actually Ovidrel. This just came in on Facebook. It says, so you talked a little bit about this, but obviously the question to dig a little bit deeper is what is HCG? How does it work? But more importantly, as it relates to the Ovidrel, like you were talking a little bit about, is there a difference between the various HCG brands and Ovidrel in terms of how they work, side effects, things like that? Is there a reason why I should use one versus the other?
Great questions. Gosh, where do I start? The HCG is HCG is HCG. So if you have been prescribed HCG, no matter which brand you get, it's going to be the same. Just pay attention to what the dosage is, because you could be prescribed a different dosage. Some people will give as little as 250 units, 2,500 units. Some people say 5,000, 750, 10,000. So listen to what your healthcare provider says of what they think the dosage is right for you. Generally is prescribed 5,000 or 10,000 units. The Ovidrel is 250 micrograms. So the studies that were done with Ovidrel, 250 micrograms is equivalent to about 5,000 units of HCG. So my personal preference, I generally give HCG 10,000 units. The Ovidrel and the 250 micrograms is likely appropriate for most patients. I also take into account the cost and what insurance covers, or if you've applied for one of the discount programs such as compassionate care, if one medication over another helps with a discount. So they work essentially the same. I hope
Thank
that
you
took
so
care
much.
of all the questions in that.
I think you did a great job. You handled everything, and this is a perfect time to point out that all of these programs are recorded so that you can go back and watch them at your leisure. So there's a lot to unpack in that question. There was a lot of questions, so a lot of answers, and I think that's something that maybe you want to go back to and take a look at. You can find that on Facebook. You can find it at our webpage. My Mandel's Pharmacy will have all that stuff at the end. But just a quick reminder that you don't have to sit there furiously taking notes, because it's 2020, so the internet will save this for you, and you don't have to worry about it. And also, just to mention, thank you, Karen, for saying that with all the different programs that are out there financially, that the pharmacy, Mandel's Pharmacy, is always here to help you with all of that, and to make sure that you get access to all the different programs that are available to help make these medications as affordable to you and accessible to you as possible. So thanks for getting a chance to get that in there. With all that said, that we have gotten through all the questions that we have right now. So again, I will throw it back over to you to give anyone another second or two if you want to get your questions typed in there, and otherwise we will move up. Actually, as I was saying that, here's a question from Tiffany. It says, in general, is there anything health-wise that we should avoid while going through the process, i.e. avoiding caffeine, avoiding alcohol, not eating certain foods, etc.? So I think this is more of a bigger, not just HCG or anything, but just the entire IVF process.
Great question, and we should probably dedicate an entire pharmacist program just to things to avoid. My personal opinion is that it's all things in moderation. Of course, we're not telling you to go out and do crack or something like that in moderation. Substances like that, obviously you don't need to do that. But some people say no caffeine. I tell people they can have 2 or 3 caffeinated beverages a day. I think that's perfectly safe. Alcohol, maybe a drink here and there, not a bottle, but a drink here and there is perfectly fine. Exercise, again, I think it's important to do moderation. Some women, it's hard for me to believe, but some women will exercise to the point that they stop having periods. Clearly, that's too much. So all things in moderation, and speak with your healthcare provider about specific things. I will put in a little hint that the drug that I see people take most commonly that can affect their ovulation is ibuprofen or any of the non-steroidal medications like Aleve, Advil, Motrin, those kind of things that can actually interfere with normal ovulation, and it can interfere with implantation. That's well described in the literature. So I would recommend that you avoid non-steroidal medications such as those that I mentioned. Tylenol is a better pain reliever. For other types of medication questions, you can always call up and talk with a pharmacist at Mandel's or check with your health care provider. Great questions.
Yes, that was an amazing question and an excellent answer, Karen. Thank you. And I would venture to guess that in 2020, with everything that's going on these days, that part about people being able to have alcohol in moderation probably just made a ton of people very, very happy. So thank you for putting that on the table. And with that being said, we have gotten through the questions that we have right now. So if anyone has a second, wants a second to type something in, but I will throw it back to you, Karen, just if there's anything else you want to wrap up before we get ready to move on to the next product.
Okay. Well, the next product that I want to share with you is progesterone in oil. This is the medication that I think patients fear the most and they have the most questions about. Progesterone in oil is always given in the muscle of your hip. The medication, just as it says, is in oil. So it's thicker and it's a little bit harder to administer just because it's thick medicine that has to go through the needle. Generally, it doesn't hurt, but if it doesn't go all the way into the muscle, then you can have some irritation, lumps, bumps, or redness. So let's just go ahead and start the video, and then I'll be happy to entertain any of your questions on the other side. So if you want to go ahead and get it queued up, Craig. Your healthcare provider has recommended that you take progesterone in oil for injection. There are a couple of ways this can be prescribed for you. One is in progesterone in oil that could be sesame oil or peanut oil. The other is progesterone and ethyl oleate. Your provider will tell you exactly which one you need. To administer this medication, you must give it intramuscularly. It's important it go deep into the muscle of your hip to make sure that it doesn't leak out into fatty tissue. You've probably heard some horror stories about people taking progesterone and oil and they say they have redness and irritation and lumps and bumps. But I promise you, if you take it where you put it deep in the muscle, you're not going to have any problems at all and it will be very easy. This is a diagram of where you should give it in the muscle of your hip. It's actually in the upper outer quadrant of your hip, as you can see the green area in this diagram. I tell patients to simply put their hands on their hip bone, relax their palm back, and give it in that muscle. It's called the ventrogluteal muscle, and that's the best place to give it to make sure that it can go deep into the muscle. To give the injection, it's really very easy. It's already mixed up. You start by taking the top off the vial of the medication. The first time you give it, there's no need in wiping it with alcohol. But with your second injection, you want to wipe it with alcohol just before you draw it up. Next, you'll need the syringe that has a needle hooked on it. And you can either use the needle that already comes with a package. It's probably going to be gray to draw it up and to administer it. Or you can change the needle and put on a bigger needle to draw it up. That just makes it easier. It is in oil, so it's going to be a little bit more effort to draw this medicine up than perhaps some of the other medicines you've taken. To put the new needle on, just screw it right on the tip of the syringe. Then remove the needle top, expose the needle. You won't mess it up. The one that looks like a nail is not the one you're going to give it with. And just take the tip of the needle and put it right into the rubber part of the top of the vial. Turn it upside down, making sure you see the needle in the liquid. That way you're not just going to withdraw air. Your prescriber will tell you exactly what your dosage is. The average dosage is about 50 milligrams, so we're going to draw that up today, and that's going to be 1 cc. And you just pull back to the amount that you've been prescribed to take. And I like to pull back right on the line and then withdraw the needle from the vial and then put just a little bit of air in there. When you do that, when you give the injection, it seals it with the air and makes sure you get all of the medication in and none of it's wasted. If you change to put a bigger needle on to withdraw it, just recap it and discard that needle in your sharps container. Put on the smaller one to administer the medication. Only on soap operas is it instant death if you get a little bit of air in there. So if you see a little air bubble in there, it's no problem at all. It's just that little bit of air, just to one line or two to give the air, just to seal it into the muscle. Then choose the location on your hip that you want to give the injection. Take an alcohol pad and wipe the area where you're going to administer it just one time. We know you're already clean. Just wipe it one time, separate the tissue, remove the top from the needle, put the needle straight in all the way. Again, you want to make sure it's going all the way into the muscle, so it's important you put the needle all the way in. Withdraw just a little bit, and you'll probably get a little bit more air. If you get a little bit of blood, just pull the needle back just a tiny bit and go ahead and push the medication in. Again, this medicine is in oil, so it takes a little bit longer to push it in. But once all of it is in, just release the skin, release the plunger, and pull straight out. If you have a little bit of fluid or a little bit of blood come out, there's no cause for alarm. Just take the alcohol pad and apply a little bit of pressure, or just wipe the area off and apply a bandage if necessary. After you give the injection, you can put the needle and syringe directly into a sharps container for safe disposal. And just like that, you've given your injection of progesterone and oil. So that wasn't so bad, was it? It's intimidating because the needle looks long and the medicine's thick. But I promise you, the secret is making sure the needle goes all the way into the muscle. It's only when it leaks into fat that you may have some issues. And in my practice, I always draw little targets on the back of the woman's hip with just parentheses using a Sharpie, just to make sure that everybody's comfortable that they're putting the medicine in just the right place. And I bet your provider would be happy to do that for you as well. As Craig starts to pull up questions, a question that I commonly get is folks are afraid if they're allergic to peanuts. Well, you don't want to, if you're allergic to peanuts, you don't want your medicine in peanut oil. So sometimes they can give sesame oil, or Mandel's Clinical Pharmacy is also a compounding pharmacy, and they can mix the medicine even in olive oil and sterile olive oil to make sure that it's something that is not going to be an allergen for you. So no fear if that's the case. There is a formulation that will work just perfectly for you. So Craig, tell me what questions you have for me.
Thank you so much. All right. So the first question that comes in, and this might be related to talking about some of the timing aspects of HCG when you were just talking about that. It says, do I have to take my progesterone and oil the same time every day, or does that not matter for this medication?
Don't wear yourself down making sure you take it exactly to the minute at the same time. It does have a little bit longer half-life. I tell patients to take it at about the same time each day. If you take it at 8 o'clock one night and you go out for dinner and you come back and it's 10 o'clock and, oh my goodness, I didn't take the injection, what do I do? It's not a problem to be off even by a few hours. But try to stay about the same time each night. It'll keep you in a good habit of what time you're taking the medicine.
Perfect. Thank you so much. It's a great answer. I think so. This one, I'm sure you're not surprised by this question because it comes up like clockwork almost every single time. But it says, intramuscular shots seem difficult, and I've heard that they can hurt. What can I do to alleviate the discomfort? And do you have any extra pro tips to suggest that I can do to make sure I do it right?
Great question. And I would wonder about that too. You know, the needle is an inch and a half long. It looks intimidating. And I've already said that the medicine's thicker. Most people say when they first start doing these injections is that they're no more difficult to receive than any of the other fertility medicines they've taken. That being said, there are a few tricks. One of them, whichever hip you're going to take it in, I recommend that people stand up to get the injections and just lift the leg, take your weight off of the leg on the side that you're going to get the injection. So that kind of loosens up the muscle. Just like when you go get your flu shot, and I hope you all do, when you're about to get the flu shot, just let your arm kind of drop down so you take all the tension and tightness out of the muscle. that kind of separates the muscle fibers to make it a little bit more comfortable for you. Sometimes people are really, really intimidated by it. There's a patch that we've covered in some of the other PharmAssist programs, and you can find that on the My Mandel's Pharmacy website, and take a look at the Sonera patch. This kind of looks like a big Band-Aid, and you just take it out of the package, has adhesive on it, and you put it directly on the location where you plan to administer the progesterone. Do that about 20 or 30 minutes before the injection, and it actually puts in some numbing medicine and heats up the site where you'll give the progesterone injection. That makes the injection go a lot easier. Some insurance covers it, some insurances don't. So you may want to weigh the risk of some mild discomfort to the cost of what the patches are. And Mandel's will work with you on trying to get insurance to cover it and talk with you about the pricing if it doesn't.
Perfect. Yes, thank you for mentioning that. That is always a great point to make, that anytime you have questions about coverage, things like that, how much things are going to cost, if there's any programs available to help you with those costs, always we're here for you at Mandel's to be able to reach out and find out any way to make it as affordable as possible. So thanks again, Karen, for pointing that out. That's another great pro tip for people when they're going through this process. So this question came in, it seems to be, Tiffany, following up a little bit on what you were just talking about, but it said, glad you mentioned the flu shot earlier. Is there a certain time that is better than others in the process, or does that part not matter?
Now is the time to get your flu shot. I have always preached for everybody to get a flu shot. The risk to taking it are minimal, but I'll tell you, if you get the flu when you're pregnant, then that has really high risk for both you and your pregnancy and the baby. So it's very important that you get a flu shot. The only real contraindications is if you're allergic to eggs, but now there's a formulation that is egg-free. Very important that you get your flu shot. It's fine to get it now. It's fine to get it early in pregnancy. But this year of all years, it's really important, because it can be confusing whether you have symptoms of COVID or if you have symptoms of the flu. The treatments are quite different, and the risk to other people are a bit different as well. So talk to your provider. Maybe they're offering them in their offices. They're widely available now at pharmacies across the country and beyond. So I picked where I got my flu shot based on what kind of freebies they had when I went to get it. So I went to a grocery store that has a pharmacy and got a $10 gift card. My husband went to Target and got a $5 gift card. So there are lots of incentives to take the flu shot this year, but mostly it's to protect you, the people you care about, and certainly a hopeful pregnancy.
Perfect. Thank you. I think the most important thing out of all that is to realize that you won in the battle between you and your husband on incentives. Clearly,
I did.
You got the better gift card. So that's awesome. Congratulations.
Thank you.
Thank you so much for that great answer. And one question that just popped up here about, I think we've talked a little bit about overuse and overdose, and can you with different products, and so here with the proj, the question comes in that's on Facebook that says, what can happen if I take too much progesterone and oil? Can that actually cause problems, or is that not an issue at all?
It would be hard to overdose on progesterone and oil. I wouldn't recommend that you try. Some providers have you take a cc, a progesterone, which is 50 milligrams twice a day. And older women and women that are using donor eggs, that may be prescribed to take it twice a day. Generally, it's just prescribed to take once a day, and it's usually just 1 cc one time a day.
Great. Thank you so much. With that, I think we're pretty much all caught up on most of the questions here. And no, sorry, I spoke too soon. There's a question just came in on the Facebook chat. Thank you for joining again, Sampathy. We appreciate it. So after completing the dosage of menopur and gonal medication, and then after retrieval of eggs, when did my ovaries go back to a normal state as they were prior to all of this treatment?
Oh, that's a good question. it's variable when your ovaries will go back down to normal size. Sometimes, if you're not pregnant, they go back down to normal much more quickly. If you're not pregnant, it may take a cycle for them to go back down to normal, and then they're back right to where they were before you started treatment. If you are pregnant, the HCG that's produced by the pregnancy stimulates the corpus luteal cyst. That's the cyst on your ovaries that forms after you ovulate. That normally makes progesterone. If you do an insemination, it'll probably still make some progesterone. If you do IVF, it's probably going to make a little less progesterone, because when we take the egg out for the egg retrieval, we're also taking all the fluid that's inside the follicle. So it may not be as efficient at making the progesterone. Nevertheless, if you're pregnant, it may take several weeks or even a couple of months to go back down to normal size. Doesn't put you in any undue risk. If they're really big, you're probably going to be told to be on pelvic rest, where you don't lift or push or pull anything heavy, and avoid any kind of strenuous activities. Your healthcare provider will help guide you based on your response, how high your estradiol level got, perhaps how many eggs you've had retrieved or had to mature. Your healthcare provider will guide you as to what physical restrictions and limitations you might have, if any.
That's great. That's a great answer. It was an excellent question. And part of what we're here, again, not to just make you comfortable with the medications themselves, but the entire process.
Absolutely.
And so sometimes, people have very, very specific questions about an individual shot, all the way up to just what is this whole thing going to be like? And that was an excellent example of that type of a question. So thank you so much, Sampathy, for all of your great questions, and Karen for your great answers. Certainly. And with that being said, I think we have gotten to the point right now where we're done with questions coming in. I will give you another, like I said, give people like 30 seconds. If you have any other questions, I'll throw it back to you, Karen, as we begin wrapping this up, and take it back to you, Karen. I'll let you know if any other questions come in.
Okay, great. So thank you all for joining us tonight. This program is designed to make you as comfortable as you can be, to make sure that you understand everything that you need to know about your injections, and, as Craig says, about the process in general. We're here for you as members of the team that put on the PharmAssist program, and as healthcare providers, we're here for you. You should always feel comfortable calling in and asking your practice that you're going to for your treatment, or Mandel Specialty Pharmacy for any questions that you have. We know that going through fertility treatment can be very stressful, can be a burden in so many different ways, and we want you to know that you're not alone in this journey, that we are here for you. So, Craig, any other questions for me?
No, that is it. Seems like we have gotten through all the questions, and everyone, there was a ton of them. So thank you so much to everybody for all of the great questions, the follow-up questions, the interactivity, even sharing words of hope and guidance with one another, which is incredible. We love that because that's what people are here for, right? Is to feel great about the process. So
absolutely,
we're good on all the questions right now. So I'll let you wrap it up, and we'll say goodnight.
Perfect. Thank you. So again, thank you all for joining us tonight. This is a program that's held every Monday night, same time every Monday, where we go through different medications. We've also got some behind the shots programs, as well as a few other programs that we're working on, just to walk with you every step of the way through this program and the whole entire process. So have a great night. Stay safe, and we look forward to seeing you again at a future PharmAssist program. Thanks so much.
Thank you, Karen. I just want to say thank you so much for your time and expertise tonight. You did an amazing job, as always, which is not a surprise. But we love to have you on for these programs and share your expertise and your knowledge and some of these great tips that you have throughout. So I just want to appreciate, I just want to let you know how much we appreciate that time. I also want to thank everyone who joined us via Zoom or Facebook Live for sharing all of your excellent questions And we really hope that you were able to learn something tonight and feel a little bit more comfortable in that process that you are undergoing as we speak. Do not forget that all, as Karen said, all these virtual learning experience videos, the entire thing, as well as the individual product demonstration videos themselves, are available on demand on our YouTube page, our Facebook page, and at our mymandelsPharmacy.com/PharmAssist page. And so you can go in there and check out everything, including the Q&A, or you can just dial it right down just to the product that you want to see, those walkthroughs. If you're getting ready to give the shot and you just want a quick refresher before you go, that's available across the board everywhere. We look forward to seeing you all here again next Monday night at 7 p.m. Eastern Standard for another great program with another great nurse. We just ask you that you share the PharmAssist program with anyone that you feel can benefit from it, a family member, a friend, anyone going through the process. Whether it's your partner and you think this is something that could be helpful for them as they're going through this with you as well. And with all that said, thank you so much to everybody. Thank you, Karen. Thank you, everyone in the chat and in the room. And have a great night.
Stay well, everyone. Good night.
See you next week.